So with that, I want to introduce Caitlin Frumerie, the Executive Director of the Rhode Island Coalition to End Homelessness, a fearless leader and a great partner since the first day I've gotten here. Thank you, Caitlin.
So again, as he stated, I'm Caitlin Frumerie, Executive Director of the Coalition. My pronouns are she, her. I'm going to see, look, and the technology is even working briefly for me. All right, so welcome. As was stated before, I want to take a moment to just thank you all for being in this room, and those of you that are watching at home, thank you. And in particular, I want to raise two of our biggest sponsors, Tufts, Point to Health, and Integra. We offered this event free because we wanted it to be accessible and not have cost as a barrier. And the sponsorship of all of our organizations today, but in particular these two, really have made that possible. So I just want to do a big thank you. If we can do a little round of applause. Because it's partnership with these organizations that make this work happen, and I think it's not ironic or coincidental that these are both healthcare organizations as well, because they're seeing that health really is housing. So the last couple of years, I have made a little joke about the dumpster fire of this previous year, and I think it's still kind of fitting. Those of you that work in this industry, I think, feel while COVID may be getting better, more people can be vaccinated, it isn't any easier. We're seeing homelessness increase dramatically, and all of us are tired because we fought the battles in each of these years, and we're just burnt out, and we're done, and we're tired. And I think each of us individually, in our families, and with our children in our lives, are all just tired. And so I do want to take a moment to just recognize that it's been really hard, and it continues to be hard, but we're all still here. We're all still trying to do this work in one way or another. We're all still advocating and working towards a Rhode Island where there's no one experiencing homelessness. So I always like to start with why homelessness happens. I think some of you probably get this, but at the risk of being redundant, I think it's helpful to contextualize this. Because homelessness is really a math error, right? It's a math problem. So 1,700, close to 1,800 is the average cost of a 2-bedroom apartment. And I want to give a thank you to Housing Works for doing this book every year that tells us this information. So in order to afford that $1,800, almost $1,800 a month apartment, you would need to make roughly $71,000 a year. That is not what the majority of Rhode Islanders make by any stretch of the imagination. So then let's think about, all right, so I maybe have 2 kids, I'm a single mom trying to make this work, get this 2-bedroom apartment. At minimum wage, I would need to work 79 weekly hours. There just isn't enough time in the day to do that, parent your kids, go to church, all of the other activities that one does in a time period. And so that's the minimum wage there at $12. The average renter's wage is $18, and then what you need to make to afford that $1,800 a month is that $35. So homelessness happens because income and housing are not compatible. That is why homelessness happens. And specifically, when we look at income in relationship to people experiencing homelessness, we see that it's drastically lower. So approximately, if you see down there, and this is people entering shelter and transitional housing, about 53% of them have absolutely no income at all. And then the next largest kind of chunk of the population that you can see there are making between $6,000 and $12,000 a year. And what you can see, that bottom line there, the darker line, is the current year. So you can see that over time, what we're doing is we're having that increase in very low incomes. So we're seeing that on average, the people that are presenting into the system are coming in with less and less in a time where you need more and more. And then if we look at those that are living outside, and you'll hear me talk a lot about people living outdoors, unsheltered, on the streets, living rough, we see in this population, about 71% of them make absolutely no income. And I want to dispel the myth that those living outside is kind of like the older white male that's chronically homeless. That's not true. People living outside look like anybody in this room. We have families living outside, we have couples, we have youth. Really, anyone in a housing market like we have today can find themselves in a situation where they're living outside. So, this is what you would need your rent to be if you were a person experiencing homelessness, right? So we say about 30% of one's income should be what they're dedicating to their rent. So if we assume a generous salary of $8,000, $200. Anybody have an apartment for $200 in this room? Yeah, right? So this is why the math just doesn't work, and we're seeing homelessness increase as rapidly as it has. So now I'm going to talk a little bit about current trends. So as Senator Reed had mentioned, we have an annual point-in-time count census that we do once a year. And I'm going to talk a little bit about homelessness right this second, but this is back in January. So this is giving a point in time of what homelessness looked like, and that was about 1,300. And you'll notice that that's certainly an overall increase from last year, but our unsheltered numbers are going up by 37%. So we're dramatically increasing over time. I remember I've been working in this industry for close to 15 years where our unsheltered numbers would be 60, 75 people in the pit, 50. So we're just living in a land that's just completely horrific and outside the norm that any of us have seen. And it's gone up consistently since the start of the pandemic. So if we look at homelessness now, we have approximately 830 in emergency shelter and transitional housing. And I'll note this doesn't include our domestic violence programs because they're not in our database. And then we have about 504 people living in cars or outdoors. And I remember when we were working on this particular slide deck, I turned to Jen, our data person, and was like, well, the 504 number has got to be wrong. That's got to be the 30-day number, not the 2-week number. And she's like, no, that's the 2-week number. So even as I'm like going through and copying this, I'm like, oh, this is outside of even what I had thought it would be. And so again, right now, that's close to 1,400 Rhode Islanders that are sleeping outside. And this gives you a little bit of a snapshot of what that number has looked like over time. And this number always has a little bit of an asterisk next to it because there isn't some magical process where somebody lives outside and we suddenly know it. We know someone is living outside because they interact with a street outreach worker or they ask for help. But a lot of people might not. We heard from Sam and her powerful story today. She didn't say, oh, I was calling, asking for it. She was afraid her kids were going to be taken away. So usually this number is actually really underreported. And any of you that are like, oh, this is too hard for me to read, we do have the slide deck posted on the website. We're also going to be posting the materials, the actual video later. So if you're wanting to kind of zoom in more, you do have that ability. So now I'm going to talk a little bit about the Coordinated Entry System, or CES. And this is the help center. This is the entry point into the system. And it's funded by the Rhode Island Continuum of Care. It is open, actually, it has another 45 or so minutes. It's open till 7 o'clock tonight. So we have a nice snapshot from utilizing the system of who enters into the system. So I often make the analogy that the CES Help Center is a little like a 911. You call it when you're in crisis, wanting to be connected to a service. Or, you need somebody, police, fire, somebody come out. The issue that we have with our help center is that when somebody calls, we don't have infinite resources. We don't have infinite housing or shelter. So often what you get told is, oh, well, I can put you on the list. And here's some other resources. Maybe it's past 5 o'clock, so that CAP agency or whatever other resource might not be open. So it's a lot of sit and wait when someone's in crisis. And so that can be really challenging. So it's a little like running a 911 when we don't have enough fire trucks and ambulances. And again, we don't want more people in shelter. We want people in housing. But this is where the structural deficit of affordable housing has really come back to hurt us now, where there just isn't enough. So this gives you a sense of the call center over time and when things peak and valley. And we haven't operated this using the data that we have now, so we'll have more over several years, but you can see that it's a pretty consistent number. I mean, we usually are higher at the beginning of the year, and again, a lot of that is around winter, because who wants to be outside in winter? Although a lot of people end up outside. So the piece that I also want to mention is, what does it look like right now, the unsheltered household? So we have lots of individuals that may call and are interested in resources or shelter, but I want to drill down on people living outside because I think that's the most vulnerable generally. So as of last week, we have 63 families with children living outside. I just want everybody settle in that for a minute, right? We have 57 adult-only households and over 250 single adults. Right? So these are families like Sam that we heard of. And this is giving you a snapshot of all of the people waiting for shelter. So some of these individuals may be doubled up. Some of these people may be facing eviction but not yet evicted. So that, again, there's different points at which they access, and maybe they're looking for diversion sources or some other resource, but it's still a very high number. And then this is a chart that's going to tell you a little bit more about where people are coming from. So if you're looking at the current living situation, which is the darker blue, so that's when someone has made that call to the help center. Where are they currently staying? So we're seeing a lot of people in unsheltered or temporary destinations. So that's maybe the couch surfing, the doubled up. The lighter blue actually tells you, okay, so I'm living outside now, but before that, where was I? So if I use Sam as an example, so she's in her car now, but before that, where was she? And that's a lot of people that presumably we're seeing coming from permanent housing and other temporary destinations. And that's an opportunity to prevent their homelessness. That's an opportunity to potentially keep them in there and not have them going into the system and experiencing the trauma of homelessness. But because the system is so logged up, there's not enough housing, and everything's so backtracked. And as even Josh, Secretary Sullivan mentioned, there's a lot of rental assistance that's come out. So these are the numbers, knowing that those resources have been used. And then this also gives you a sense of how long people are waiting on the queue. Now, some people may wait on the queue and self-resolve, and we might not always know that, so we'll always take it with a grain of salt. But you're seeing here is that half of households have been on the queue between 7 and 29 days. So going back to my 911 analogy, that's oh, your house is on fire. I have 100 other fires first. I can get to your fire in a week or 2 weeks from now. And I want to talk a little bit more about why does this happen, right? So homelessness is certainly an economic problem, but it's, like I said, it comes down to a math problem. So our supply and demand isn't quite fitting. And the hard part is, I don't want people in shelter, right? We want people in housing. But what we're seeing is a demand, and this upper blue line actually is only unsheltered adults. So that's not even everybody. I wanted to focus in on those that are outside. So it's those households. And then how many referrals we actually made. So we may have close to 300 people demanding and needing shelter, but only 30 referrals. And then it's a little bit better here when we look at families, but it's still, you can see there's that gap there. And that gap was a lot bigger before we had other family resources that came online. So now I'm going to talk a little bit about the demographics. So we've talked about, okay, where are we now as a state? We have discussed why does homelessness happen, and I kind of want to wrap it up a little bit. Well, who actually becomes homeless? So we talked about income. It's primarily people with little to no income. But in terms of age, we do see a spread. And you can see this is the top blue, the lighter blue is shelter. The bottom is street outreach, so those living outside. So we have a lot of young children under 5 living in our shelter system. And then you'll also see the decline in the age as it kind of gets down there. So it's like a bell curve, but it's a little bit steeper than the age you might see broken down in the kind of general population of Rhode Island. And that's because people experiencing homelessness on average die about 20 years sooner than the general population. So the lifespan that you typically see is about 45 to 55 years. So again, the trauma of homelessness is literally hurting the health of people and leading to earlier and unwarranted death. And then I want to talk a little bit about diversity and race, because it's an important component here. So this is giving you a breakdown of, down here you can see is Rhode Island. So this is our racial breakdown in Rhode Island. And then you see unsheltered and emergency shelter and transitional housing. And this is just adults and couples. So while we might have Black persons making up only 8% of the state, they represent almost 3 times that. 23% living in emergency shelter. So there's something happening here that this doesn't represent that. And I think we all know about the impact of systemic racism and oppression and the way that COVID and the economy has impacted different populations. And it's even more garbage when you look at families. And so here, we can see that while, again, Black persons make up only roughly 9% of the state, they're about 30% of the families that are living in emergency shelter and transitional housing. And even more, 34% when we look at those living outdoors. So racism and systemic oppression are very real, and we're seeing it in our unsheltered and emergency shelter system. And then I also want to look a little bit at ethnicity. So for our single adults, our Hispanic representation is actually pretty proportional there. You can see that it's actually a little bit less unsheltered, a little bit more, but kind of a nominal difference. But when you actually look at families, and again, the reason we separate these two is the experience of families experiencing homelessness is very different than individuals. And I think Sam's story really alluded to that, where you're worried about children, you're worried about school and potential DCYF. It's just a different presentation. And so here we've got, again, Hispanic representing 7% of the state, but 40% of the families that are living in emergency shelter or transitional housing. Almost 40, and then roughly 43% for those outdoors. So I've talked a lot about how challenging the data is, and behind the data is a person, right? So when I talk about the data being challenging, what I'm saying is that the lives of Rhode Islanders are really, really tough right now. But there always is good news, and there's always things that we can do. So I am really excited in Rhode Island that we had the state budget that we had last year. So there's a significant investment, a significant portion of the state's budget that is going to be spent on housing, including $35 million for efforts to prevent and end homelessness. And hopefully I touched on the importance of prevention and diversion and problem solving as a way to really stem the tide. And we also have the creation of the first ever Department of Housing. We heard Josh Saul speak with us today. And that really is going to help elevate the issue and make sure that we have the leadership to see the resources that we've already come out to have that continue to exist. We also have the development of a plan to end youth homelessness that was submitted to HUD, along with a significant amount of resources to go with it. So these are 3 really big major wins. And I think one other win that I'll just elevate is the ingenuity of all of the staff in our service provider organizations. I cannot overstate how tremendous each of our nonprofits are. And my job is the easy job. Their job is the hard job. So the fact that everybody's still here and doing this work and showing up and coming hearts full to do this work is a bigger asset to Rhode Island than even money is. Because without, you can have the money, but without the hearts and the humans to do the work, it all falls apart. So how do we address Rhode Island? How do we address this kind of crisis? So some of what we need the state of Rhode Island and the legislation to do, and you've heard me talk about this, Josh certainly knows these things, but we want to have resources to prevent and end homelessness and have those be as flexible as possible. We need to certainly increase the supply of crisis housing and shelter, really focusing on innovative models that are going to meet people where they're at. You can't put 100 people in bunk beds in a gymnasium. It just doesn't work. We also, most importantly, need to dramatically increase the supply of affordable housing. And that affordable housing needs to be for people who are extremely low income, because that's who we're serving. And we also need to emphasize permanent supportive housing. So those people that have those complex health needs and have been homeless for a really long time are having their needs meet as well. We also need the state to continue to create this robust Department of Housing and consider reconvening the Interagency Council on Homelessness to really bring all state departments coming together to address this crisis. And lastly, we always need to treat housing as healthcare and not silo it. It's not just about the apartment, it's about all of these other components within the system. We also need our beloved federal government to continue to support us. It would be wonderful if we could get housing choice vouchers as an entitlement program, so everybody got them that was eligible. We always need more funding for the HUD homeless assistance grants and a lot of the regulatory waivers that existed as part of COVID. We need those to be codified and continued. And lastly, I need you, all of you in this room. We need you to get involved. We need you to volunteer. We need you to go to your city or town and ask to be on their planning commission, ask to be on their zoning commission. We need you to treat people experiencing homelessness with compassion. Ask them a question. Talk about what you've learned here tonight with your family and your friends. Make it an issue. Vote. And really just lead with compassion. People experiencing homelessness did not choose this. Nobody wants this. It's a circumstance. As Josh called it, it's a systems failure. And lastly, I need you all, and I'm going to ask you to do it. I need you all to say yes in my backyard. Can everybody say yes in my backyard? Yes in my backyard. Not no, not in my backyard. So we all need to become yes in my backyard people, because the next part of this is going to be building affordable housing. And we want affordable housing in every community in your state. The only way that's going to happen is if all of us get involved in our community and say, yes, I want to end homelessness in our state, and I want to have housing. I want to have my children grow up in a diverse environment where no one else experiences homelessness. So I want to thank you all, and hopefully you feel fired up. I know that Louisa's going to close us out here, but really, it's all of you. We can do this, and it's by getting involved and starting a conversation.
Can I ask you a question? 200 million from the budget from 2023 is going toward this. So what is our total budget? Like
The total state budget?
Like what percentage is 200 million out of the total?
So I know I feel like it was like 20% of the ARPA budget, but I don't know what percent it was of the total state budget, and I'm not going to respond on behalf of the state, because that's where I get in trouble. We can get, maybe Josh can answer.
Talk after.
Yeah.
Because that costs a lot of money, but maybe it's not that much of a percentage. I don't know.
I mean, I think we had wanted as advocates 500 million in the budget, but again, that amount is a significant portion. But the problem and the part that we all need to be doing is yes in my backyard, right? We all need to be part of that. So thank you.
Thank you. Thank you.
Thank you, Caitlin, captain of the ship at the coalition. I'd like to thank all of our speakers again, and all of you for joining us here tonight. As Caitlin have said, and I also bears repeating, we can't do this work without the entire community backing us and supporting us. Again, folks who are joining this stream at home or here with us in person, your support of us, whether it's monetarily, whether it's at the ballot box or in your community every day. That is what will end homelessness in our state ultimately. I would love for all of you to stick around and introduce yourselves, get to know us. I think that a stronger community, of course, is one way to ensure that no one has to experience homelessness in our state ever again. Thank you once again, everyone, for joining us tonight, and have a lovely rest of your evening.
Thank you.